breast can really start to hurt the moment you're pregnant. And some patients, along with nausea, they will start experiencing this breast fullness the moment they are pregnant. And this is very typical in first trimester, and it continues in second and third trimester. It's almost like your whole body, including your breast, starts having all sort of pregnancy changes because it has these estrogen progesterone receptors on it, so it will react to your pregnancy. So it can feel like full breast, like really heavy breast, the moment you get pregnant, and like sometimes that can be painful. So when that happens and when that is like concerning to you, don't worry, it's just a pregnancy change. You can consider wearing a loose bra so that you don't hit yourself, and you don't keep on bumping into each other. This is just gonna increase over time. Also, there can be changes on your nipple and areola. It can become bigger. So the idea of the whole thing is that your breasts are getting ready for breastfeeding. So start preparing yourself that you can do it, you can breastfeed your baby. And I never really want to decide for you what you should do. You are the best judge of that. But at the same time, as a physician and as like someone who's an advocate of well-being, I highly encourage you have to try breastfeeding. Yes, it comes with a lot of flaws, but the benefits are amazing. The nature made us to breastfeed. So when our breasts are like normal, right? Like we never really have any breast issues throughout our lifetime, and when we are pregnant, suddenly they start becoming big. Like suppose suddenly they're supposed to hold milk. So our body slowly prepares us to have that milk in the breast so that we can eventually be able to tolerate. Because when after delivery, when we suddenly start having milk, it can be painful, especially for someone who has a low pain threshold. Someone who can handle pain well, she might not say this. So the breast pain is normal. It might feel heavy. It's okay. You can consider moisturizing your nipples, especially some patients will get dryness of their nipples, so consider moisturizing it with any moisturizer. There is no baby right now, so you don't need to worry about it going to the baby. But after delivery, when this happens, when I have like a whole series on lactation, I would talk more about that. Some patients in pregnancy can experience breast milk coming out or some sort of colostrum coming out, and that happens typically at the end of the pregnancy. The colostrum starts forming by 35 weeks, and most lactation consultants actually advocate expressing colostrum and saving it for the baby in syringes. And I myself did that from 38th week. Every day I was expressing. My sister did that, and we saved the milk for our baby because I was going to be a cesarean, so I wanted some feed for the baby, and it was there, and that was amazing. But that's not available for everyone because most patients get scared with colostrum expression because it can produce labor-like pains, and there are a lot of myths around, like milk let down and your baby passed away and all of that. It's a myth. It's not for sure. I have seen plenty of patients who had a letdown in pregnancy and nothing bad happened. So there is no hard evidence to support that. All right. So apart from that, take care of your breast. It's normal. You don't need an analgesic, but if you can't deal with the pain, please get one. Like paracetamol should be fine.